Here we go. Okay, so again, I'm Dr. Elizabeth Geddes-Bruce. I am a board certified dermatologist. I have also received extra training after residency. I did a cosmetic fellowship in laser surgery. I have been doing Smartlipo laser liposuction for a solid decade now, which is crazy how fast time flies as you get older. And I think that's important. Experience matters. Never be afraid to talk to your doctor and ask what their experience is. I practice at the Far West location at Westlake Dermatology, which is off of Far West Boulevard, right next to a Starbucks. We have an OR in this practice, and yeah. So if you're wanting to know more after this webinar, we'll probably have a consultant reach out to you, email you for more details. And you can always come see me for a consultation or with one of our consultants as well. So let's get going. So what is Smartlipo laser liposuction? So this is a procedure that is designed to take fat cells from targeted areas of the body. It is not an overall weight loss procedure. It is for my stomach has always been a troublesome area, so I'd like to get that flat, or my hips have always been kind of big. I have like a muffin top, my outer thighs, they've always stuck out, things like that. In order to get Smartlipo laser liposuction, you really need to be a healthy individual and you need to be relatively active. This is a cosmetic procedure. Our number one concern is your safety. Number two is getting you the best results possible. So you also have to be a good candidate for a cosmetic procedure. Downtime for Smartlipo is about a week, maybe a little bit less than that. You wear bandage after the procedure, compresses the area, and I'll get into that more going forward. The results are immediate. The fat is removed, but there is some swelling that kind of obscures like the final results that takes some time to show. So a little bit about liposuction. Oop. Well, I did awesome. Hold on. Let's see. Having a technical difficulty. Let's open that back up. Okay, here we go. I hope everyone can still see this screen. Let's see. I'm gonna just like shrink me and go here so I can see the screen as well. Okay, hopefully everyone can still see this. So I've been doing this webinar for years and I'm messing up now. Okay, so liposuction. This is the procedure where we take fat cells and we're able to create a new shape for your body. So let's say this little group of fat cells is what we're dealing with. If you lose weight, your fat cells just shrink in size. And that's because we are all born with a certain number of fat cells in our body. When we gain weight, they get bigger. When we lose weight, they shrink down. So the shape is still there. But when you remove the cells, you're able to change the contour, the actual body shape permanently. And if you lose weight after liposuction, the results look even more incredible. So how does this procedure work? Well, a few details of it. It's an extremely safe procedure. You're completely awake and breathing on your own throughout the whole procedure. I tell patients that if in the middle they have to go to the bathroom, we just pause and they get up and they go walk to the bathroom. We give you medications to kind of calm your nerves a little bit. We give you antibiotics to prevent infection. We give you some anti-nausea medicine to help prevent any kind of nausea. And then what happens is you come in that day The nurse takes your photos. We go over the areas that you have discussed previously with me during the pre-op, and we mark them out. And then the numbing fluid is put into that specific area. Then comes the laser. So the laser goes into the fat, helps to soften it and make it easier to remove, and also helps to seal some of the blood vessels so that you get less bruising. Then we actually remove the fat with a tiny little instrument called a cannula. And then we get you dressed up. We put some pads on the areas. We put compression garments on you, and we send you home and tell you to relax. At about a week, you can kind of get back to some physical activity. And that's about it. So this is just an image of the numbing part, right? So tumescent liposuction, that refers to putting these large volumes of fluid, the anesthetic fluid, into the fatty layer. So you're not going under anesthesia where there is, a machine keeping you breathing, or where you're going to be completely out of it. No, you are awake, and the anesthesia is done to the local tissue. And once that anesthesia fills up that fat area, it gets firm, and it allows us to use a cannula so that the cannula is able to remove the fat in these little strokes. And so we make a tiny hole in the skin. The cannula is itty bitty, and it's blunt at the end. It's not sharp, but it's kind of like a straw. It has an opening on the side, and we remove those fat cells. So I was gonna go over some before and afters, but I thought it might be a nice idea to show you how to look at before and afters on our website, because then you can keep looking at it whenever, like on your home time. So this is the Westlake Dermatology website, right? You can go to www.westlakedermatology.com. And then if you go under the cosmetic tab, you can go to body contouring. And then over on this left side, it has all the different body contouring procedures that we offer, like Avelli's for cellulite, cool sculpting's like completely non-invasive, fat transfer, liposuction, Smartlipo, the laser liposuction that we talked about today. And so you can go click to Smartlipo, and you scroll down, and here's our gallery of all the different before and afters. And so you click on that gallery, and you can pick all the different doctors at Westlake Dermatology that offer Smartlipo. So I'm going to go to me, so Dr. Elizabeth Geddes-Bruce. So you can look at the cases that we have, which the patients have given us permission to share the results online. And you can click through. So this is liposuction of the, flanks and hips and waist, the whole kind of like back area, before and after, right? And then up here is how you go to a different case. And this looks very similar. And this is, if you're looking at, okay, I'm interested in doing Smartlipo of the under part of my chin. And if you go down here, you can click on some more pictures, and you can see, nice improvement of the jawline and just removal of that adipose tissue. And so you can go through all the different photos, right, where you see removal here again. So mental liposuction, that's one area. Here's probably waist flanks. This is our main form of Smartlipo that we do. A lot of our patients do what's called Smartlipo 360, which is where you treat the upper and lower abdomen, right, as well as the waist and flanks, to really just improve that overall contour. Again, we got more pictures of the necks. You can see, some before and after of working on some of those hip, waist, flank areas, the love handles, flattening the stomach. Some pictures of the knees. Smartlipo treating that kind of area right above the knees, getting some good improvement in her texture. Again, so this is kind of, like an easy way for you if you want to like go online and go through all the different photos that we have. We've got more that you can see in person. Not everyone agrees to let their photos be shown online, even though that would be lovely if they did, but we totally understand the need for privacy. But, also treating the arms, again, the stomach. Here's a guy. Most of our patients are women, but we have plenty of men too. They often like to treat that flank. They like to make that stomach really flat. Just the back area. So these are all the different like before and afters that you can go through. And again, you can filter it by the different doctor and see some of their different cases and results. So that's kind of it for my general spiel on Smartlipo laser liposuction. That gives you kind of a few details about it. I know sometimes patients want to know about pricing. At Westlake Dermatology, it's priced per area. So, the abdominal area or the waist flanks or the chin. And the pricing is normally $1,600 an area. Although this month it's on sale, it's $1,200 an area. And for attending this webinar, you actually get an additional $100 off an area with a minimum of 3 areas. The only areas that are priced higher are the submental chin. That is $2,500 because it's more technically challenging. And then the arms, because it's 2 spots. That's a total of $2,000. And we can always give you, a personalized quote if you come in for a consultation. So if you look on the this webinar thing, there is a chat function, a question and answer area. You're welcome to ask any questions that you might have on Smartlipo, and I'd be happy to answer them around in front of all of you guys. That's really it. I'll give you a few minutes. I'll be here hanging out. I can answer any questions on the different things regarding Smartlipo, or also if you've got any other cosmetic dermatology questions, I'm happy to talk about those as well. So any questions were here? Otherwise, thanks for showing up. And like I said, you all get credit and that discount. And the next steps going forward is our consultant will probably send you an email tomorrow. And in it will have sort of details on if you'd like to schedule a consultation. The consultation's complimentary. You don't have to pay anything for it. If you want to see me as the doctor for the consultation, it is a 10-minute appointment, and it's quick. If you'd like to have a more in-depth consultation, we have a dedicated consultant that spends a very long time with you. If there's any questions, she can come grab me to look at a specific area and make sure that you're a candidate or not. And that's the kind of 2 differences. She's very highly trained, and I'm always available. So let's see. I think there's a few. Okay, we'll get into some of the questions. Okay, so the first question is, how long do the results last for? Well, the results are permanent. So when, like I was saying earlier, if you lose weight, those fat cells you have shrink, and then when you gain weight, they fill up with lipid. If you do Smartlipo, you remove the fat, And so those results are permanent. You are forever going to have less fat cells there. Now, if you gain a substantial amount of weight, then those fat cells that are there can grow and grow and grow to the point where you probably will never be as the same size you were before, but the results won't be nearly as impressive. So it's best if your weight is relatively stable. If you're someone who kind of cycles up and down, I'd say like 50 pounds, you really need to be stable for a while. But the results are permanent. The next question is, do you recommend lymphatic drainage massage before or afterwards? That's a great question. Um, Whenever we're doing Smartlipo, the procedure itself damages little lymphatic vessels, and those always grow back, but their job in the skin is to remove fluid. So if you want your results to kind of like appear quicker, you want your swelling to go down, you should consider investing in lymphatic massages. We don't offer those here personally at Westlake Dermatology. There are a lot of lymphatic massage places all throughout Austin. We have a few we can refer you to if you're interested in. Sometimes people YouTube and see what's done. It's not a very aggressive massage. It is very like light and gentle, and people are generally very happy with it. Myself as a physician, I do not feel like the lymphatic massage makes or breaks your results. So I think it's like icing on the cake and can help you kind of heal quicker, but I don't think that not doing it is going to make you not get a good result. I think I feel very strongly the results are made in the operating room, and the lymphatic massages don't have a long-term effect on how you turn out. Yeah. Okay, another question. She said, I may have missed it, but what is the downtime? So the downtime for Smart Lipo is on average about a week. We ask you to refrain from like very vigorous physical activity for about a week. But what happens is you do the procedure, you're in the office, like so we have you come in at 11 a.m. We probably start the procedure at 1. That's after everything's all numb and you're all ready to go. You're out of here by 3:34 on average, and then you go home and recover. That first night's a little bit rough, probably the worst part. The next day is still but then it gets better and better as the days go forward. I've had plenty of patients say it just felt like a very hard workout. And you're able to walk around, you're able to go to the bathroom, you're not going to have any drains. You are wearing compression clothing. So when we do the Smart Lipo, we leave these I mean, they're tiny, tiny little holes where we put the instrument in to remove the fat open. And that actually helps you heal quicker. The fluid comes out of those holes and goes into the bandages, and the garments hold it in for the first 24 hours. After that, you just wear it's like a leotard and like a little binder on top, and you need to be pretty strict about that for about a week. And then after that, you can be a little more like definitely way more relaxed on it. Sometimes I tell patients they can burn the garments at this point, switch to Spanx or whatever just makes them feel comfortable. At a week, they can get back into their physical activity. Of course, you like ease into it. I wouldn't go run a marathon afterwards, although I did have a patient one time. I called her post-op day 1 and she had been running the Austin Marathon. That was a bad decision. She was fine, but in general, we like to tell you to please wait about a week. But just to get back to it, people can go to work. Maybe the next day you don't want to go to work, so you can just kind of take it easy. We give you pain medicine, Tylenol 3. It's just Tylenol with a little bit of codeine. It takes the edge off. So that next day you can kind of relax, but plenty of people end up going back to work. Is the recovery period due to the incisions or the fat removal? The recovery period's really due to mostly the fat removal. The incisions are very, very tiny. And if you've ever had like a mole removed, that's much bigger probably than the little incisions. It's due to just the trauma of the area, and we're putting the compression on you to prevent any kind of like bleeding or fluid collections called seromas, things like that. Would a man's belly cost include the love handles as well as the stomach? No. Love handles in general is like what we refer to as the flanks. The flanks are a separate area than the stomach. Okay. Is this a good procedure for fat above the knees? Sure. I mean, it depends, right? I have to see your knee, but it's a lovely procedure for fat above the knees. Will there be lesions where the cannula is inserted? Yes. So anytime you make a hole in the skin, anytime, you will be left with a little scar. They're small. They're about 2 millimeters. So 2 millimeters are very tiny, but it starts off red and then it turns, kind of like your skin colored or a little bit whiter. On most people, they're not very noticeable. But it is something to consider if you're darker skin typed, if you have more melanin in your skin, brown eyes like me, things like that. And after you get like an injury or a pimple, you're left with a brown mark that stays for a long time, or your scars go brown, then you can expect that those spots can also have a risk of going brown. And we've got different creams to minimize that. But yes, you are trading having tiny little scars to have the fat gone. Will there be bruising? It depends. Some people bruise a ton. Some people, I feel like I look at their legs and they bruise just with anything. So definitely if you're doing liposuction on your thighs, I always want to warn people that there would absolutely be bruising. Don't think that necessarily at like a week and a half you'll be in a bathing suit and nobody can tell. For the stomach area, it just depends. Some people bruise, some people don't. What about the skin around the area? Will it be saggy? That is a great question. So just like when you lose weight by diet and exercise, sometimes the skin goes saggy, and it depends a little bit on your age, your skin quality, and things like that. Um, I'm always, I would say, pleasantly surprised by how well the skin retracts back, but skin laxity is a factor in deciding to do this or not. So some people are like, well, gone are my days of wearing a bikini. I want to look like awesome in my clothes. I want my stomach flat. I wear one piece anyways. I don't mind if there's some saggy skin. Whereas other people are like, wow, my goal is to just like look incredible naked. And if you're at risk for saggy skin, you're a better candidate probably for something called like an abdominoplasty, or that's also known as a tummy tuck. And that's when I don't do that. That's when you go under anesthesia, drains, big recovery. The plastic surgeons do that. That's when, you get the incision, but the skin is pulled tight. So you can have this like super flat stomach, no saggy skin. So that's definitely a consideration. Also in the neck area, right? Some people, the neck retracts back nicely. Other people, if you're a little bit older, and then you might have some loose skin there. And so you have to decide, is the improvement in the contour worth the loose skin, or do you want to treat the loose skin? And the way to treat the loose skin on the neck is a facelift. Those are some really good questions. I got through all of them. If anybody else has anything, speak now or forever hold your peace. No, I'm just kidding. I'm happy to see you in office. Go over any other questions. Look at your body and make a decision with you if this is the best decision for you. It's one of my most favorite procedures to perform because I love a good before and after, and it is something that people are so happy afterwards. I had a girl who said that she was, took off her bandage around her neck last week and literally started crying because she was so happy. So a lot of times people feel unhappy about their body and maybe they live this way their whole life, and this is your chance to change things. But you have to be a good candidate, and I can help you make that decision. And we're here if you need us. Okay. Again, we got a few more questions. Great. Just one more, actually. Can you lay on your tummy if you had it done on your abdomen? Sure. Yeah. I mean, it might be a little uncomfortable that first night laying on your stomach, but you're not going to hurt anything by laying on your stomach. Okay, that's it. All right, everybody. Have a good evening. Take care.